This was a biopsy done from the nipple of a woman to rule out basal cell carcinoma. A BARAP4 stain was done to look for basal cell carcinoma, the suspected diagnosis. And indeed, the BARAP4 stain did mark something brown. However, if you did more than one stain, you saw that the tissue was also positive for cytokeratin 7. That will become important in a moment. So unfortunately in this case, all that was done was a BARAP4 stain and the diagnosis of basal cell carcinoma was rendered. The Mohs surgeon began doing Mohs for basal cell carcinoma on the nipple, and he contacted me and said, yes, Dr. Such and Such gave me a diagnosis of basal cell carcinoma, but I'm doing Mohs surgery and it doesn't look like any basal cell carcinoma I've ever seen before. And I said, well, that does concern me a little bit. Can you go ahead and stop what you're doing and send all the tissue to me and I'll see what's going on. So these were the frozen sections here, and you can see it looks a little different from a basal cell carcinoma. It's on the nipple of a woman. So he sent in all the tissue, including tissue that showed that it was actually breast carcinoma down deep in the tissue that was coming up to the surface near the nipple. And as far as I know, breast carcinoma should never be treated with Mohs surgery. So this was a case where a little bit more thorough investigation using multiple immunostains showed that the cells were positive for BARAP4, and it turns out that BARAP4 does mark not only basal cell carcinoma, but also breast carcinoma, but the cells were also positive for CK7, for HER2/neu, and had a markedly elevated proliferative index, and this was ductal carcinoma of the breast that had just simply gone up to the nipple and was captured in a skin biopsy. So this highlights the importance that sometimes more than one immunostain must be done to come up with the correct diagnosis. This was breast cancer, not basal cell carcinoma.